Okay, we have case B, and we were asked to interview a healthcare social worker. But just a little bit about case B first is we have Lindsay. She's 20 years old. She has normal vital signs, but her heart rate is a little bit elevated. She has type 1 diabetes, and her chief complaint is that she has a chipped front tooth. Her medical history is that she was diagnosed with type 1 diabetes 5 years ago. She is bulimic and she wants help. Her dental history is that she usually visits the dentist twice a year, but hasn't gone the last year and a half since she started college. But she is really concerned about having a good smile for her dance performances. She is on insulin for her diabetes, and then she also takes diet pills that was given to her from someone at dance. She is a full time college student majoring in contemporary dance, and she's worried that she isn't good enough to become a professional dancer. This is her chart and her probe depths, and she has erosion on the linguals of the maxillary anteriors, recession, and chipped incisal edges on 9 and 25. She has chapped lips, intraoral, she has xerostomia, and then she has a hole in the gingiva near 24 and 25. She has erythematic gums, knife-edged margin with bulbous papilla, firm, smooth, and shiny. She has localized supraspicules, and she has some suspicious areas on number 30 and localized light bone loss where 5 millimeter pockets are. And then there's some intraoral photos.
For treatment, all we're gonna watch for her HbA1c number, monitor vitals, erosion due to bulimia. For DHDX, her general moderate periodontitis with localized severe in quad 4 due to diabetes, medications, and bulimia. For treatment plan, we'll do 4341 all quads. First appointment, just debridement on quad 1 and 4, OHG, Canberra, and LA is needed. Appointment 2, debridement, quad 2 and 3 in OHG, and schedule 4 to 6 weeks evaluation, and then PM from then on. For oral hygiene education, nutritional counseling, rinse with water after vomiting, consult with doctor after diet pills, about diet pills, and then cleaning tongue piercing.
And we had the opportunity to interview, excuse me, my mom, who's actually a social worker. So, Tiffany is a licensed clinical social worker with 9 years of experience. She specializes in teen and young adult mental health. She has helped launch programs for youth, including online-based programs, and she stays active in the community and regularly volunteers for mental health presentations and outreach. And then for interview questions, how important do you feel interprofessional collaboration is for your patients? Tiffany said that that's actually a tough question, mostly because I think it depends on the express needs of the client and if the client is asking for collaboration or if there's an absolute medical need for it. I think that patients have the right to autonomy unless it is harm to themselves or others, but for the most part, we treat them for their needs, but let them be themselves. Um, Next question, do you feel like your patient's physical, mental, social health affects their oral health? Tiffany said, I think that it can, because if you're working with someone with depression, it is most likely they are struggling with overall self-care. And number three, do you feel like your patient's oral health affects their physical, mental, and social health? Tiffany answered, saying, with teenagers and kids, it seems like they don't care about it, but when they do, they get pretty anxious about how they appear. In general, the way their smile looks affects their social and mental state. Number four, how often do you inquire about oral health of your patients? She said she only inquires about oral health when I can tell they are looking disheveled or give me reasons to ask them because that suggests that they are not taking care of themselves. And dental health relates to self-care in general, and that is usually the first thing that goes with mental health issues. And number 5, what would you do if your patient asked you about their oral health or had concerns about it? Tiffany said, I would talk to them about the importance of going to their dentist. I would ask if they had a dentist, if they had insurance, and help them looking into their insurance benefits. She would help by giving resources as needed and giving them support with appointments.
And we would ask her, if this was your patient, what would be your main goal for treatment? She said perfectionism. And also assessment for OCD, anxiety, and depression. And also if patient's going to go to see a doctor for weight management and also nutrition, and go to a dentist because bulimia is bad for your teeth. And would you work with any other healthcare professionals to help patients meet their treatment goals? She said yes. I will get consent first and call their doctor for more information. And do you feel like working with dental professionals will help your patient meet their treatment goals? She said yes, because we are trying to decrease bulimia. I would 100% collaborate with dental professionals. I would ask her if there is anyone that you want me to collaborate with.
And then as far as her dental history, we asked, knowing this information, does it change any of your answers from before? She said that she would refine the goal on the therapist side, and she just said that she would focus on values and what is important. And then she would want to integrate a mental health care integration program in the dental office, and it would greatly benefit patients like Lindsay. And then if this was your patient, what would you want their dental provider to be aware of before their appointment? And she said progress on their goals, and then look for areas they're still working on, go over bulimia, and then this is just assuming that we have already been collaborating together. And then what would you want the dental provider to do or focus on during this patient's treatment? And she said that she would have to have patient consent, and then once she got consent, she would see what Lindsay would want to have her share with the dentist, and then and then she would share with the dentist to be aware of bulimia and the perfectionist behavior. And then she feels like any other comments or questions, she wants mental health care integration, and it should be a standard of care. And we just want to thank Tiffany.